got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, and the longest-running show on this channel. I'm Dr. Steve. My little pal, Dr. Scott, the traditional Chinese medicine provider, gives me street cred with the whack alternative medicine asshats. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacey. Hello, Tacey.
Hello.
And also back from sabbatical, NP Mel B. Hello.
Hi.
You look delightful today. No one can see you on camera, unfortunately.
Yeah.
I'm redoing the
thank you.
cameras. I've been saying I'm going to do that, but no one cares, particularly those listening on the radio. This is a show for people who never listened to a medical show on the radio. If you got a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy I can't mention contractually. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right, very good. Check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. Where he sells the best CBD nasal spray that I've ever encountered. I use it every day myself. Yes. This is not an ad.
No, sir, but it's good for you.
Yeah. Okay, according to Dr. Scott.
Only for me, that's right.
There you go, anyway. All right, very good. Well, NP Mel B, you're back. Last time you were here, we got a YouTube strike for me putting your surgical pathology
Oops.
up on the thing. Yeah, apparently you're not supposed to do that. I don't know.
Did they say it was gross?
Yeah, it was just triggering
Graphic.
or something. It was too graphic. That's okay.
It was just barbecued chicken.
That's what it looked like, didn't it?
Mm-hmm.
Raw.
It's
what
pretty
looked like-
impressive.
yeah, raw chicken sort of parts with barbecue sauce on it.
Yeah.
And yeah, so how's the post-thyroidectomy thing
Still
going?
going good.
Yeah, good. Yeah, your
Yeah.
voice. I sound
It's
like
getting
you
better.
did
Yes,
back
my
then
voice
right
is getting
now.
better.
I have, every once in a while, I get this virus where I get laryngitis
Mm-hmm.
and my voice will drop about an octave. And this is the voice. If I had a voice, I could work with this.
Mm-hmm.
If I had this all the time, I could mold it into something that would be a much better radio voice than the one I actually have.
This is definitely the male version of the Fun Girls.
Yeah. Hello, doll.
Hello, doll.
I masturbated, doll. For those who linger longer. Mel B doesn't know what I'm talking about.
No, and that's all right.
Yeah, I dated the Fun Girls.
Yes, we've talked
Oh,
about
okay,
this.
you know that. Okay, all right, you know
From
that
Andy
story.
Griffith.
Right,
Yep.
that's right.
That's exactly right.
Yeah, the younger one was the one that I actually, anyway, had intercourse with, and she was like, "Oh, Bernie, hello, Bernie," and then the older one, "Hello, doll," was the one that that's my biggest regret is that I did not stay and have intercourse with her. I was 17. It was my first experience. First experience with a woman.
Oh, man.
And that's my biggest regret. I got out of there so fast.
And I understand that you had a life before us, but that story is so bothersome.
Well, now that you have kids that are in that age group, it's creepy.
It's terrifying.
Yeah. And, yeah, but anyway. Why don't you stick around, doll?
Oh, my God. Steve.
Hey, doll, can you get me another one of those cigarettes?
Yeah. And she takes a glass of water and dumps it
Stop
on
it.
her
That's
chest
enough.
and goes, "Oops," and then took my hand to rub the water off of her chest.
Oh.
I was freaking the F out, and it's oh God. Anyway,
TMI.
Anyway.
That's
not
worse.
TMI.
That's worse.
I
That's
mean,
worse. That's worse than a picture of a thyroid, isn't it?
Yeah.
Just a little bit.
really, no, yeah, that's the thing. I can tell that story.
And not get no
Yeah,
problem.
no problems. Show
Totally
a picture
fine.
of an actual thyroid. And
Yeah, and it's just like the laws. For example, we deal with the state of Virginia sometimes, and when you do a medical advanced care plan, if I'm a notary,
Okay.
I've taken the oath, I took the class, I paid the fee, I've got the stamp, I'm bonded, and I'm insured. Someone signs a medical advanced care plan in the state of Virginia, and I notarize it. It's no good. It's not legal. But you get two crackheads literally cooking meth in your parking lot and bring them in to witness it. Totally fine.
Oh my gosh.
Totally fine.
Lord.
Yeah,
Yeah, it is. It's an interesting.
yeah, it's
Thing.
something.
Fucking idiot.
Oh no, that was the wrong one. Wait a minute.
Well, that's because you're an idiot.
And that is the law. If that is the law, then the law is a ass. Anybody remember where that came from for a bell? Name the author. If that is the law, then the law is a ass.
William Shakespeare.
No, boo.
Take a bell away.
Yeah,
Take a bell.
Dickens.
Ah,
Anyway.
damn, that was my third guess.
No. All right. Well, Tacey, do you have topics today?
I sure do.
All right. Well, let's just get into it.
It's Tacey's time of topics. A time for Tacey to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacey.
Well, hello, everyone.
Hello.
I have one smart article. It's a little too smart. And then I
Okay.
have one really dumb one.
Excellent.
So let's
Save
start
the
with
best
this.
for last. Do the dumb one last.
Yeah, that's what I was thinking. So let's start. This one is from Stacy DeLoach, everyone.
Okay.
Energy-starved breast cancer cells consume their surroundings for fuel.
Yes.
Breast cancer cells ingest and consume the matrix surrounding them to overcome starvation. And this is according to a new study published in the open access journal PLOS Biology.
Yeah.
The finding elucidates a previously unknown mechanism of cancer cell survival and may offer a new target for therapy development. Now, Steve, is this any news to anyone?
Not really. I mean, we know that cancer cells recruit their own blood supply, and if they outgrow their blood supply, then the tumor will die, and that's what causes necrotic tumors. But yeah, if if cancer cells they're like everything else, they want to live. I mean, that's a teleological explanation. They don't want anything, but they are designed or programmed or whatever. Their mechanism wants, them to persist, so they'll do about anything that they can, and including taking energy away from cells around them.
Well, then I'm not going to read it because it's a
No,
lot
it's
of
okay.
gobbledygook.
It's a lot of what?
Gobbledygook.
Gobbledygook. Okay.
Gobbledygook.
Gobbledygook.
Okay.
Okay. So, yeah. So, I mean, was there anything else in there? Did they identify anything interesting?
I mean, no, not from what I remember. It was just like, and the poo poo poo, and it goes into the la la la, and then they eat, and I don't. So, I mean, it was just.
You see? Your stupid minds. Stupid.
I mean, I don't want to put people to sleep. I appreciate
Okay.
Stacy's input, but it's like this is not a show for.
Yeah, advancements and
for
Unless there's something
advanced physicians.
Right.
I mean,
Okay.
not even the regular doctors, like the smart ones.
Yeah, we're not cool enough for the oncologists to be listening to us. And
Yeah.
that stuff
They-
is too.
they ain't
The
paying
researchers
attention.
certainly
Right.
not.
So
Okay.
okay, so here's
Well,
the dumb
you do
one.
have editorial, authority. You don't have to just throw everything up that's sent to you.
Well, I thought about it, but then as I was reading it, I remembered how smart it was, and then that's why I asked you that question.
Yeah, fair. Okay.
So, 8 mistakes people make when they're getting sick. Okay, so everybody's getting sick. So listen up, people. Let's go.
yeah.
Don't try to power through it. Don't keep up with your usual routine. Your body needs energy to fight off that cold or flu virus, so make rest a priority. A lot of people don't do that.
We'll make lemons out of lemonade. When my voice gets like this, I call all my friends and do phony phone calls. Why? Because Myrtle sounds way more authentic. When I got the wheel, I was just going to call you and see if you're all right. That's way more authentic than when I normally do it. Anyway.
Do not ignore flu symptoms. You usually don't need to see a doctor for a run-of-the-mill cold, but call them if you have signs of the flu, like a high fever, body aches, and fatigue. They can give you an antiviral drug such as Tamiflu or Relenza.
Yeah, Relenza's that's the kick-ass one.
That's the hard one to get a hold of, though.
It is hard to get a hold of, but I prefer it. Tacey can't take Tamiflu.
Throw up all over everything.
But Relenza, no problem. Relenza's inhaled. It's an inhaled powder.
Tamiflu, I get no warning. Like I'd be sitting here talking to you and it just vomit everywhere. It's
very attractive.
Crazy. Driving down the road, it happened
Like
to me.
projectile vomiting?
Projectile.
Awesome.
Yeah. Yeah. No warning. No warning.
No warning. Projectile vomiting. Awesome.
Yeah. So,
Tell me more. Tell me more.
You know what? You had your story. I have mine. If you take one in the first 48 hours that you're sick, you can ease your symptoms and shorten your illness by 1 to 2 days.
Yeah.
You skimp on sleep, not getting enough weakens your immune system, which makes it harder for you to battle that infection. One study found that people who get less than 6 hours of shut-eye a night are 4 times more likely to get sick than those who log at least 7. So go to bed early and take naps during the day.
Yes.
And if your symptoms are keeping up, soothe the nighttime cough with a little honey and run a humidifier to help you breathe easier.
Ooh.
I thought you said honey and rum, not run.
Well, I would say both would work.
Yeah.
I like
Honey
the
or
rum.
rum.
Unless you're
and-
sober, in which case.
Then it's
Yes,
not so good. Then
and
just
it's
honey.
not a good
Then don't
idea.
do
Then
that.
just honey.
Yeah, then just honey.
Are we acknowledging the new presence in the room?
No, I was going to. I was going to wait for a natural break, but I guess
Okay,
that's fun.
this
So,
is-
hello, everyone. It's our buddy Stacy Deloach in the
Stacey Deloach.
studio. Yay. Hello, buddy. Yeah, we just shit on your question that you sent to Tacey. You missed that.
It was just too smart.
It wasn't. You did a great job. I was listening to you.
Oh, you were? Okay. Well, if you want to grab
She's a natural.
chair, you're
a
more than
natural.
welcome to, and just sit next to Mel B there.
She's a natural.
If you want to. If you want to.
She did a wonderful
All right.
job.
Okay. Number 4, you bug your doctor for an antibiotic. Stop doing this. That prescription won't make you feel better. Antibiotics only kill bacteria, and colds and flus are caused by viruses. And as Steve always says, viruses got to live too.
Well, and the thing is that people, you pay good money. Either you're paying a copay or you're paying money to go see a provider, and then they tell you, well, you got a virus, go take, go take NyQuil. People get pissed.
Mm-hmm.
So the providers are under some pressure to give you a prescription for something, and that's where this antibiotic abuse came from.
Yeah, it says nearly 1/3 of them are unnecessary.
Yeah,
the
I
prescriptions.
totally agree. Totally agree. And, unless you've got evidence of pneumonia or a true sinus infection, so many people are called sinus infections when they're really just a viral upper respiratory infection.
You know, it can also raise your risk of side effects like diarrhea and allergic reactions.
You get the green apple quick step.
Yeah,
don't
there
you know?
go. And then also, you have the whole antibiotic resistance problem.
Correct. That's the bigger
That's
problem.
the problem.
You can get bacteria that are resistant in your own body. We did an experiment in medical school where you took your own shit, and of course we called it fecal matter.
Mm-hmm.
But you took your own shit, and then we analyzed it for antibiotic resistance, and we found we could isolate the plasmids that were where bacteria, one form of bacteria will teach other bacteria how to be resistant to things. And I had taken, I think, amoxicillin for acne back then, and the professor was he was pumped. It's like, oh, you have amoxicillin resistant, bacteria in your stool, and it was from taking that. So it is. We have had to fight bacteria in hospital. Back in the day, everything was sensitive to penicillin. Now, very few things are actually still sensitive to penicillin. One that is group A strep, though.
Strep, yeah.
It's crazy. Group A strep is so dumb, knock on wood, it's never figured out how to be resistant to penicillin. One of the reasons for that is that just a couple of doses will kill all of it.
Gotcha.
And that's where resistance comes from. Let's talk about that just for a second. Well, Mel B, you want to talk about how things become resistant, how you get a resistant population? She's saying no. Okay, that's fine. So what people often will do is they take half their antibiotics and they feel better and then they quit taking it.
Right.
And what happens is let's say you have a million bacteria, but now you're going to have hundreds of billions of bacteria. But you have a million bacteria, and 10% of them will, let's say even 1% are resistant. So you kill all of the bacteria, and you've got that 1% that have slight resistance to this antibiotic that you had. If you'd kept taking it, they would have eventually died, but you didn't. And so now that 1% doubles and then doubles again and doubles again, and their doubling time is measured in minutes, not days and weeks. Yeah. And the next thing you know is you have a whole population of bacteria that are actually resistant.
Yeah, they don't respond to that antibiotic.
Same thing with cancer. I mean, that's what happens is, you kick back cancer, but 1% of those cancer cells are resistant to what you get because natural variation. That's what protects us from all dying from one virus is we have this natural variation. Well, cancer cells have that too. Bacteria have that, et cetera. So what we've done in this country is by overusing bacteria or antibacterials and people not taking their medication all the way to the end to kill all of the slightly resistant bacteria, we've got this problem of resistance where we have multiply resistant bacteria in the ICU. We can't kill them. There's no antibiotic that will kill multi-drug resistant Acinetobacter. And, what were you going to say? Nothing. I thought you were waving. Okay. Anyway.
I was going to say, take all your antibiotics.
Yep. Yeah. So if you are given antibiotics, take them all.
Right.
Anyway, go ahead, Tay. Sorry.
You don't drink enough. When your throat aches, it's not easy to gulp down liquids, but when you stay hydrated, you can thin your mucus and break up congestion.
Please don't ever tell Tacey that. You don't drink enough.
It can also...
That's not wine, Tacey. It's water, not wine.
It can also fend off headaches. Make sure you drink plenty of water. For extra relief, sip a warm beverage like a herbal tea or broth. Research shows that it can help ease cold symptoms such as fatigue or sore throat.
Or what?
Sore throat.
Okay.
Yeah.
Is that gobbledygook? What was it that you said?
Gobbledygook.
Gollygook.
Gobbledygook. I didn't even say it right. Gobbledygook.
Drink more water is my answer to everything.
Yeah. Drink more water.
My kids
always
call
good.
me. They say I don't feel good. I'm like, you should drink more water. They hang up on me.
My ex-wife, when her kids would get sick, I remember when they were like 5 or 6 or something, and she'd say, "What's wrong with them? What's wrong with them?" I said, "It's a virus." I remember her stomping up the stairs going, "That's your favorite word." So, because most of the time that's what it is.
Most of the time it is. And most of the time it'll run its course.
Yep.
Yeah.
Don't forget to eat. That's
Right.
a pretty easy one.
Yeah.
Don't smoke. Smoking damages your lungs and irritates your throat. That can make your cold symptoms worse.
That's a good answer to about everything. Don't smoke.
Yeah, that's a pretty good answer.
Don't get stressed out. A hormone your body makes when you're stressed is hard on the immune system. It also increases inflammation. What is this, cortisol?
Yeah, that is true.
Which can make your stuffy nose even worse. Make an effort to focus on relaxing and recovering. So if you're sick, just be sick.
Cortisone is an anti-inflammatory, but it also, as being an anti-inflammatory, it can reduce your immune system's vigor when it's trying to fight something. So
Yeah.
that's a good one. Yeah.
And with everything going around right now, just use the vampire cough.
Yeah.
So.
Cough into your elbow like Bela Lugosi
Yeah.
did in Plan 9 from Outer Space.
So you're not like snotting on your hands and then rubbing them on everything.
So taste. What does that mean? You should. The old wives' tale. You should starve a virus and feed a.
I mean,
Yeah, that's a
no,
bunch
it
of
wasn't.
shit.
So in other words, you feed it and you drink it.
Yeah, feed it and drink it.
Feed it and drink it.
Anyway, well, good.
Those are
All
good
right.
topics. Excellent.
I should have followed some of that advice probably. I got COVID, and then I turned around and got pneumonia, and then I've got this damn thing.
Well, the
And I
problem
got tested
with
for, everything. I got tested for RSV, influenza, and COVID, and I don't have any of that. It's just some dumbass shitting ass virus.
the problem with professionals is they feel like they can't stop and take time to be sick,
Yeah.
and it makes things worse.
Well, I did this last time. The first time I got COVID, I got Delta, and it was bad, and I never missed a day. This time, I was like, you know what? I'm using my sick PTO, and I didn't work. I didn't do anything.
So that concludes
few phone
Tacey's
calls.
topic.
Okay, that was a good one. Thank you, Tacey. It's very
Great
timely. All right. Do we have any questions from the waiting room from the Fluid family?
Not yet.
Dr. Scott. Okay.
Not
very good.
yet.
Well, let's. You guys want to do? Stacy, what's going on with you, man?
Passing through, headed to New Jersey. Figured I'd stop and harass
Are you?
everybody.
So, talk into the microphone and tell us some maritime news.
Let's talk about something you and I experienced a couple of months ago.
Okay. Well, talk into the microphone.
Okay. I'm used to looking at you while
That's
I'm talking.
okay. No,
and
don't
everything.
do that.
Yeah, don't look at him.
I just drew a blank on it,
Oh, for fuck's sake.
and it was so exciting too. Cabbage.
What is it?
The erectile dysfunction where you stab yourself in your junk.
Okay, yeah, okay. Let's talk about it. What
It is scary at first.
so Caverject is alprostadil. It's a prostaglandin that is injected into the base of the penis.
Which is scary to think that you're going to stab yourself.
Yeah. Now you use a 30 gauge needle, like a
Diabetic.
like a diabetic needle. It's a little bit thicker than a human hair.
But it's about 3 times as long as like the ones that come into Ozempic.
Right.
So it's
Because it's
scary.
got to go all the way in because you
Right.
got a big meaty, package.
Yeah, no, that's why I'm taking it.
Okay, right, fair. So, yeah, tell us the story. So you had erectile dysfunction,
Right.
and you were taking everything,
A
right?
little bit of everything, a lot of herbal stuff, everything I could try.
Well, you tried, and then you tried the Viagra's and the.
And got massive sinus headaches and panic attacks and all kinds of stuff when it wouldn't work.
Yeah.
And so I came to you about it. Several years ago, there was Muse, which was a urethra suppository.
Right. Muse was an alprostadil urethral suppository.
Which seems worse than a shot to me.
It-
That seems worse.
It's a little
way
pellet
worse.
on the end of a thing that looks like a benzene ring, kind of. It's a hexagon. And you would put the little pellet. It's a little tiny pellet.
Yeah, it was about
And
the
you-
third of the size of a grain of rice.
And you would jam it into the urethra through
Slowly,
the
it's well
urethral
lubricated.
meatus,
No,
aka the cockhole.
thanks.
And then you would
There's
click.
a little plunger on the backside.
Correct.
And you push the plunger, and that, left the little grain up in there.
Yep.
Took about 10 minutes.
Do you
It was-
pucker? You pucker when you get that little.
After the first time you do it, it
don't-
is
you don't
so
pucker?
impressive.
Oh, is
the
it really?
results, it's worth it.
Oh, okay,
Yeah.
gotcha.
So how long did it last?
About 45 minutes.
Is that right? What?
Damn.
It was enough that there was
That's
some
long enough for the prelude.
I was gonna say it's just enough.
It
to
was
get
long enough that there was
warmed up.
Sudafed standing by.
Wow.
Because Sudafed will kill it.
Correct.
So yeah, there was emergency Sudafed. It was impressive.
Wow.
It's the only time that the ex-wife tapped out. That's it. No more. Can't stand it.
Wow. Wow.
They don't make it anymore.
Yeah.
It was too good.
Yeah.
So the new thing, my biggest
Well,
fear.
everyone had the same reaction that everyone other than you and me had. It was like, I'm not jamming something up my cock hole, so it just didn't sell.
Nope.
That's
it was
really-
impressive.
Yeah, but
compared to the new stuff.
I had
Not if you've had Not if he's.
had
But
patients-
you all have been traumatized.
Woo, sweet mother.
I had patients that loved it. You have to come in the first time,
Right.
and it's a little bit embarrassing. You have to go to the provider, and they have to show you how to do it actually on your junk and make sure that it works before they can send you out.
Right.
So it was a real process.
Yeah, I bet.
Now, this is also true of the injection.
Yes.
If it's done right, you have to come into the provider's office, let them do the first injection and show you how to do it. But anyway.
That's how good a friend Stephen ours, he's held my junk and stabbed me.
Yes,
Well, that is true.
That's what you do. That's what you do for your friends.
But my biggest fear was I hate needles.
Yeah, yeah.
You know, the hardest thing I ever did in my entire life when I was in law enforcement, I went to EMT school and I got IVOS.
Yeah.
Because I was going for paramedic. And you had to start 5 lines on your partner. You had to start 5 lines on yourself. And just so I developed such a fear of needles.
Yeah.
Now, that's the reason why the COVID vaccine, you're not stabbing me.
Yeah.
It ain't going to happen. Until this stuff came out.
Yeah.
And
it's interesting that, you wouldn't take a vaccine to, maybe
save your life, but
prevent
you'll have
you
one for a
because you-
Woody.
yeah,
That's such a boy.
It's a matter of what your value is.
That's such a boy thing.
Yeah.
Well, it's like I didn't quit smoking because of lung cancer and heart attack. I quit smoking because I heard that it's the number one cause of erectile dysfunction in men over 40.
The amazing thing about this, though, now I got like 75% quality out of it,
Out of
the injection.
okay,
When I actually tried it. But the amazing, like I said, my biggest fear was stabbing myself.
yeah. Well, you came into my office.
I did.
And so I wrote the prescription, and you came into my office,
Right.
and then I had to give you the injection and show you how to do it, and then you had to wait there
Right.
and tell me.
See, he wasn't going to help on the best part when he says you have to massage it. I was going to massage it for a while.
He's a fucking idiot.
Yeah,
Nice.
not doing
Okay,
that.
bad joke,
You
bad
gotta have
joke.
limits. There's got to be limits.
But anyway,
But
okay.
the thing was, is I didn't realize that inside the penis there's no nerve endings. So other than just like taking your finger and pushing it against your hand, once you get past that, once it breaks into the skin, there's no feeling in there.
Yeah.
It's kind of
Pressure.
Breast tissue is
Yeah,
kind of the
Pressure.
same way.
It's
If you're,
pressure, but not nerve. Yeah, not,
Right.
not sensory nerve.
if you're doing a needle body biopsy or draining a cyst in the breast,
Right.
you would think that it would really be painful. But once the needle goes in, every woman that I've ever done that on has told me it's just on the skin. After that, they didn't feel anything.
right. So
Yeah.
that's what amazed me about this is that I thought I was going to be laying on the floor screaming and crying.
Yeah. So, and to be clear, with most needle sticks, that's the case.
Right.
If you miss the cutaneous or superficial nerves, then a lot of times once you get through that skin inside the muscle tissue is primarily pressure and not pain sensors.
Right.
So you get a lot more. So that's why even sometimes when they do surgeries, they can once they get you numbed on the outside, the inside is not is a
That's
little bit
true.
easier.
Yeah.
So that's not uncommon.
Okay.
Yeah.
But this right here, I could dial from a 2.5 to a 5 to a 7.5 to a 10.
Uh-oh.
After you played with it for a little bit and you figured out if you needed more juice or less juice.
Right
so you
on.
could kind of dial it in. Or there's another one which is either a 10 or a 20, for volume.
Mm-hmm.
But I was glad that I've got insurance because it's going to be like $750 for 2 of these,
What? For 2 of what?
for 2 of the syringes.
Is that two injections?
Oh, you got the brand name one. Okay, now you can get. Okay, let's talk about this. So you got Caverject.
Yes. I got
Caverject.
what my friend wrote me.
Well, because your insurance would cover it. But Caverject is the branded version of alprostadil, and what you're paying for is this delivery system. Because, like he said, you can dial the dose, and then it gives a metered dose. Now,
Gotcha,
there is a
gotcha.
way for people who you trust to do it properly to get generic alprostadil, and you just draw it up and inject it yourself. That can be done. There's nothing preventing you from doing that. That's very inexpensive to do.
This
it
one
that
here,
way.
I actually had to jailbreak it. We're not going to talk about how you did it,
No,
how I did it,
don't-
or anything.
Don't tell us. Don't tell us.
But to get to a higher dosage with it.
Oh my goodness!
Oh,
I don't want to know anything.
no, hell
We're not going
no!
any
Here we
farther
go.
than-
Here
no.
we go. We're going to be
I don't
banned
want to know
again.
anything about it.
We're
But my-
banned again.
My biggest fear, though, was the size of the
God
needle.
damn.
You have to go in either at, if you picture, okay, I have to quit using this phrase because when I was teaching maritime schools and everything, I would say clockwise, counterclockwise. And my little children would just look at me just kind of, what?
Oh, because they don't
They
use
can't
the dial
read an
anymore.
analog,
Yeah,
an
yeah.
analog watch or a clock or anything. But it
Interesting.
either goes in at the 10 o'clock or the 2 o'clock position.
But
And my fear was as long as the needle was, okay, what if it goes inside of my urethra?
Oh, God. Well, don't stick it in that far.
Yeah.
Well, yeah, but look at how long the needle is.
Yeah.
It's kind of like, we're going to give this a shot and see what happens.
Yeah.
But I wanted to thank you. It's impressive.
Oh, good. Good.
Yeah,
Well, I'm glad. So you've been using it? You got...
I'm 62 years old, and my girlfriend is 30.
Oh.
Oh.
Wow.
Oh.
Oh, let me see. There you go.
I need lots of kudos sounds there. But
Well, that's because you're an idiot.
and luckily, with my insurance, it says $750. It's $45 for two.
Wow.
Yeah, you don't want to through and through with that puncture.
Now, you did
That's a waste of money.
acoustic shockwave therapy,
Yes.
too, right? Did you get anything
Nope.
out of that?
Nope.
Nothing.
Nothing.
How much did it cost?
$850.
Wow. Really, you got no benefit from it at all?
None.
Okay. Yeah, it's one of those things like, if people use Rogaine,
Right.
33% will get nothing. 33% will get to keep the hair that they have, and then 33% will grow. So about a third do really well with it. And so, yeah, you pay the $800, and sometimes it helps.
It's a
Sometimes it
roll
doesn't.
of the dice.
What you're really doing with the acoustic shockwave therapy is inducing microtrauma, which induces stem cells to regenerate the spongiform tissue in there.
Speaking of which, this isn't the perfect time for it, but did you see the newest study for getting into the brain without surgically doing is through ultrasounds and exactly what you're talking about, this sonic therapy.
Oh, really?
Yeah. So
what do they do with
to allow medicines, they'll actually put people in a scanner.
Yes.
They'll put them in a scanner and they stimulate, so it allows the medicine to get through the blood-brain barrier.
We talked about this. I
think we were going to it, but we didn't get to it.
Wasn't that one of your?
I mean, something like that. Yeah.
Where they
Yeah.
there's medications that won't pass the blood-brain barrier, but what they can do is they give those medications and then hit them with ultrasound at the at the layer of the meningeal lining, and it will actually allow those medications through.
Yeah.
And we talked about that could be bad because the blood-brain barrier is there for a reason.
Yeah.
And as long as it's temporary and only happens while they're doing that, it might be a really good thing.
Well, that's what I was reading earlier in the week, and I had actually seen a little bit of it on television. But they're using this to actually treat brain-specific injuries, strokes, Alzheimer's,
Yes.
dementias, and things of
Yeah,
that nature.
well,
MS,
I'm really hoping for some, the last big frontier is the neurologic system. Repairing spinal fractures, of the cord, like Christopher Reeve, and other, obviously lots of other people who have had spinal cord injuries, and also figuring out. I mean, we don't know what consciousness is, so how are we going to fix it when it gets screwed up? Just dumping buckets of serotonin into people's brains works for some people when it comes to depression, but lots of people it just doesn't work.
Well, it's the neurological thing too. It's not just the central nervous system, the peripheral nervous system. Because we all see people all the time with neuropathies.
Yeah.
And or after they've had a surgery on the knee, and all of a sudden they get a neuropathy in their foot, and it's not,
Right.
and we can't get that pain to calm down. They get drop foot,
Yeah.
things like that. Just
complex regional
yeah,
pain syndrome. and all
CRPS.
that
Sure.
stuff,
I mean,
yeah.
it's just
Well,
getting the nerves is really the next big thing. You're
The
right.
supplement, I have peripheral neuropathy, just came out of nothing. And I feel like, do you know how you feel when you play, like when you finger pick a guitar or you're on the fretboard all the time and you get that little callus on there and you lose some fine, that's how the tips of my fingers feel all the time. I have to see something or I can't manipulate it anymore, which is kind of sad.
I went through a bout where my hands would just. This is right after I had my little mini stroke and everything, 2017, and my hands would just stop working. I would just have to smash them into the table, wake them up.
Wow.
Kinda, hey, look, now we're working.
Wow.
There's like a shortage in there. That's when the ED started and everything.
What's kind of is a shortage. That's exactly.
Yeah.
Just the nerves are not communicating normally. Sometimes it's in your brain, sometimes it's in the periphery.
Yeah.
Right.
Well, you ready to do some questions?
Yeah, man.
Number one thing, don't take advice from some asshole on the radio.
All right. First one, I do want to do this from 2021, but we never got to it. I
Good
wish
evening,
we had.
Dr. Steve. This is Brendan, medical student from Philadelphia,
Hey,
enjoying the downhill slope towards graduation and residency. I texted earlier that I matched my number one choice for surgery, which I'm very excited about.
Excellent.
Cool.
So what happens is sort of like the military in a way that they tell you where you're going to go. You get the highest place that ranked you the highest. That's how this works. You have a list, they have a list, and the computer matches you up with the highest place that you ranked that ranked you the highest. Anyway.
Thank you for the years of my random texts and giving me information and guidance. I like to say I'm the beneficiary of those who have come before me and great mentors, and it was a great thing to have folks like you who I could just reach out to. Hope all's well. Have a good one.
Yeah, you too, man. So he would be a second year or third year surgical resident now. So had to do all his training during COVID. That's always lovely. I really feel bad for people who started their training during COVID, don't you?
That's when I started.
Yeah. Well,
Yeah.
that is true. Well, you were a nurse before, though.
I was a
but
nurse
yeah.
before.
But yeah, you did all your nurse practitioner stuff during
I
COVID.
finished my master's program in 2020.
God.
In my last semester, when all those really important clinical hours take place with you and a couple other people, got cut short, and I didn't even get to finish my hours.
Is that right?
Well, we finished
Wait a
technically
minute.
the hours,
Okay.
but it was done through continuing education and online classes and CMEs and things like
Well,
that. and
in
not
your
real
case,
life
it worked great.
experience.
You're one of the best, advanced practice providers I've ever worked with. So, yeah, for real. Yeah. NP Mel B is no bullshit. She's the real deal.
Yeah.
Yeah. All right.
Hey, it's Pat. What
Hey, Pat.
is the composition of vaginal fluid, and what is everything you need to know about vagina health?
Okay.
Hey, thank you very
can-
much for being on the radio.
Hey, thanks,
very much
Pat.
for the Sirius XM.
All right.
I can do a Tacy's time of topic on that if we would like to.
Do you have it? Ready?
Already ready?
No, I don't have it already
Woo.
ready.
I was gonna say that would be awesome.
I thought you were saying, wow, I was going to be very impressed. I still will be impressed, but I'll give the Reader's Digest version, and then maybe
Okay.
next time you can do, because we did do Fast Vag Facts with DNP Carissa.
Yeah, we did penis health.
Yes.
Which was really a good topic.
Yep, that's right. We were very interested in that.
So not.
It was perfect.
Let me answer this particular question about what vaginal fluid is supposed to be. It's mostly water.
Yeah.
Because our bodies are mostly water. And it's got some salts. It's got a little phosphate in it, a little sodium chloride. There's some organic compounds in there because it is mucus. And there's some fat cells and amino acids. There's antibodies that float around in there that help the body reduce the risk of infections and stuff. And then there's old cells.
Dead skin cells.
Yeah, dead, vaginal. Dead vaginal skin cells and uterus and cervical cells. Now, when naughty bacteria get in there, then that changes things. So you can get a thing called bacterial vaginosis. That's where the sort of fishy smell comes from. And we actually will diagnose it that way. You do a thing called the whiff test. So you can take vaginal fluid, put it on a slide, and then add potassium hydroxide to it. And then you smell it. And if it smells like fish, then that is suggestive. Now, you want to look under the microscope and see what are called clue cells, which are white blood cells with bacteria all over them. And when you see those, then you can make the diagnosis of bacterial vaginosis. And then all you have to do is replace those bad bacteria with good bacteria. So one way you can treat it is with plain yogurt.
Okay.
Because one of the evidence that either the sim programmers that created this universe or the creator of the universe has a sense of humor is the fact that the bacteria that make the vagina healthy is the same bacteria that makes yogurt. So I think that's, but so you can take plain yogurt, you could use that, or you could take a medication called metronidazole, which also you cannot drink with because it acts like a drug called antabuse. which it makes you extremely sick if you drink while you're taking it. So.
Yes, violently.
So wouldn't you try the yogurt first?
Yeah, I think so.
I mean, ideally, yeah.
Yeah. Now, how do you get it in there? Well, don't use fruit on the bottom yogurt. Use plain yogurt.
Yeah.
And then,
Not a frozen popsicle yogurt. No.
Well, that might be. No, that would be bad.
That would be terrible.
And,
Turkey baster.
yeah, kind of. You want a sort of a turkey baster kind of thing. You could take a monostat applicator.
Yeah.
Which is basically just a hollow, really large bore syringe kind of thing, not a needle. But and you just draw it up in there and then squirt it on in. If it doesn't work, then you can always do the metronidazole. But if you don't know what it is and you are having vaginal problems, go see your OBGYN. Don't listen to me. Right.
Merely suggestions.
Right.
That's
it could
right.
be a number of things.
We're just giving you things that we
topics of
tell
discussion.
people to
That's
do.
right.
All right. Then there are the other bacteria like gonorrhea, chlamydia, and stuff like that cause other problems. So, and the problem with chlamydia is it can be asymptomatic until it's not. A man can have asymptomatic chlamydia, give it to a woman, then the woman can get a thing called a tubo-ovarian abscess from that, which can cause infertility and all kinds of stuff. So, when they want to test you for this stuff, just let them do it.
Yeah.
Because it's so common and they're actually pretty easy to treat. Yeah. So, okie doke. All right. Let's do, how about this one?
Hey, Steve Areno, everybody.
Okay.
KC.
That's not my name.
All right. Yeah, cool.
Hey, man. You're good.
Anyway, sorry I did that initially.
It's
How
fine.
you doing? Hey, Steve, what's going on?
It's totally
all
fine.
right, yeah, me too. Cool.
Jesus. Oh, my
Anyway.
God.
Get to it. The clock's ticking.
Okay. Oh, wait. Oh.
Supplements maybe help.
Sorry, let me.
Because I'm at the vitamin shop, and we hear these zinc supplements maybe help a little in the fight against COVID once you have it. But what about some preemptive measures? Maybe taking some zinc now? I mean, what harm could it do? I remember the ADAC, vitamin A, D, E, and K. So don't do those. Those are fat soluble.
Very good.
Anyway,
Give thyself a bell.
He remembered A, D, E, and K are fat-soluble vitamins, and
Somebody's
therefore,
been paying attention.
Yeah, very good. Don't overdose on those, or don't megadose those drugs.
Anyway,
Yeah.
what about the zinc? And do you recommend any other precautionary measures maybe?
Sure. Well, now I'll talk a little bit about zinc and common cold, and then if you guys want to talk about preventing, viruses, that's pretty easy stuff. But so there have been therapeutic trials of zinc. This is why people were pushing zinc for, the virus that causes COVID-19, SARS-CoV-2. Because other coronaviruses have been shown to respond to zinc. And so, people were like, well, people were crazy thinking all the, zinc and all these other medications, the eye drug and all that stuff. But there were reasons why they thought these things. And wouldn't it have been nice if we had something off the shelf that we could use? Well, anyway, 10 studies reported on durations of symptoms while taking zinc. They were taking 10 to 24 milligrams of zinc gluconate, a lozenge taken every 1 to 4 hours during the day for 3 to 7 days. And 6 of the studies were similar enough to allow for pooling of the results. So, they did this meta-analysis of the data. And the pooled results showed patients who took zinc had a shorter duration of cold symptoms compared with those on placebo. Now, it was pooled results from 5 trials revealed that zinc significantly reduced the severity of symptoms by a standard effect size of 0.39, which is considered a small to moderate effect. So it has some effect. The zinc nasal spray was shown to be effective for the cold, but it also was shown to cause anosmia or loss of the sense of smell. So those were taken off the market, but the zinc lozenges still seem to have some efficacy when it comes to the common cold. Now, I have no data that shows that if you take them while a cold is going around, that'll prevent anything. Go ahead, Taze.
Every time you come home from the hospital with some disease, my friends are like, do you have echinacea on board? Do you have vitamin C? Do you have all this other stuff? You should be taking it right now. Is that bull hockey?
So they're all prescribing, practicing medicine without a license. A lot of Tasty's friends like to do that. And vitamin C not really shown any efficacy that I'm aware of. And
what about echinacea?
Scott?
Well, I was going to say what I would suggest, seriously, what it's been proven is salt water and gargling will kind of help keep the virus from getting in your mouth and throat, and CBD nasal sprays will help. I've got evidence. I've got evidence.
Where's your? If you have evidence, I do want to see.
I've got evidence. I've got evidence. It's been shown the CBD cannabinoids have been shown inside the nasal passages to block certain viruses from being
Send
absorbed.
That to me,
yes,
and
I
we'll
sure
do...
will.
Okay.
I sure will. By gosh.
All right.
So I'm just looking at the data on echinacea. There is some data that says it might slightly reduce your chances of catching a cold, not been shown to shorten the length of a cold. Zinc is the only thing that I'm aware of that's ever shown any efficacy.
What about sambuca or elderberry? Elderberry,
yes,
a natural
they
antiviral.
say elderberry too.
Natural antiviral.
Well, no.
Allegedly.
Let's see. Elderberry.
Oh, here we go.
Well,
I'm in trouble. Hurry up.
Common cold.
Clock tick. Tick, tick, tick.
Okay. Participants suffering from a cold episode while taking elderberry would on average experience a 2-day shorter duration of the cold, would experience lower symptom severity.
Right on.
So let's see what kind of study this was. This.
Oh,
fuck
now
off.
I am in trouble.
You want to know if the data's good, right?
Of course.
Okay.
This is a bail for that.
Okay.
I should have got a bell already. Right.
Eat shit, because it was a randomized, double-blind, placebo-controlled clinical trial. So.
Listen to me.
I can endorse elderberry under those circumstances.
Me.
It's not going to hurt anything.
So my friends that practice medicine without a license are actually correct.
Well, a clock is right twice a day, even if it's broken. So.
Unless it's a digital clock.
Yeah, unless it's a digital clock, in which case it's blank.
I always lie to them and say, yes, I've got it anyway. So
no, I've got no problem. This is a randomized, double-blind, placebo-controlled clinical trial of 312 economy class passengers traveling from Australia to an overseas destination, aimed to investigate if standardized membrane-filtered elderberry had beneficial effects on physical, respiratory, and mental health. Wow.
There you go.
But what a crazy study, though.
That's kind of crazy.
Yeah, placebo
captive audience. So.
Participants had a significantly longer duration of cold episode. Days. Okay, so in pooled, it was 117 versus 57. And on the average symptom score of those days was significantly higher. So that's pretty interesting. Now, we got to look at this, has to be reproduced, right? I'm just looking at one study. There are ways that a study like this could be biased very easily. If the treatment group had more comorbidity or fewer comorbidities than the other group and all that. So you always got to look at that stuff because we want to really know things. I don't want to take elderberry for a cold if it's just bullshit because I'm just wasting my money. But this is, at least it's double-blind, placebo-controlled. They showed statistically significant results. If somebody had a cold and they took zinc and elderberry, I would not make fun of them in any way for doing that. I think they would have a reasonable reason for doing that. So anyway, what were some of the other things you were talking about? But can we just talk about the number one thing is don't stick your fingers in your mouth.
Yeah.
Don't stick your fingers in your nose and wash your hands before you eat.
Keep your fingers
vampire cough.
Yep, and vampire cough. Yes. All right. Very good. Excellent. All right. And this is sort of along the same way.
Hi, I have a question.
Okay.
This is Alex.
Hey, Alex.
I was wondering if allergies could trigger sinus infections if they're not treated properly. I wanted to know if sinus infections could be triggered from allergies.
Absolutely. absolutely. You want to talk about that a little bit, NPMLB?
Well, the bacteria gets into your sinuses and doesn't get out, and bacteria multiply and grow.
Sure.
As they multiply and grow, your symptoms get worse.
Right, because of the allergies,
right,
you have bigger tissues, and bigger tissues means less free drainage, and less free drainage means pooling of fluids, and the next thing you know,
and a lot of times your sinuses
more
will crack.
snot.
Well, and then your sinuses get dry and crack inside. And then the bacteria grows in there, and they produce more mucus, and it's just a constant.
So yes, treat your allergies.
Absolutely.
And one of our favorite things is NP Mel B's favorite thing, which was the Navage. If you go look on our YouTube channel,
yes,
it's one of our featured videos.
Thing. You were here that day.
I was there.
Was NP Mel B
using doing this right here?
Yes.
using the Navage nasal irrigator basically in front of the inventor.
Yes.
Yeah, because Martin Hoke was there.
On the phone.
Yeah,
he was with us.
And but anyway, she hates to put things in her nose, but you got a free Navage out of it. Have you ever used it since then?
I've tried to use it twice when I've been really sick, and I mainly just gag.
You still can't do it.
Yeah, I do recommend for other people.
Yeah.
If you've got a neti pot, if you've got a way to flush your sinuses.
Do you have good batteries in that thing? It's got.
I do.
You got to have good batteries in it. You just can't do it.
No.
It worked wonders for me.
Yes.
I was so impressed with it. I went and bought one.
Yeah.
Yeah.
I was amazed at the gunk that came out.
And your nose feels so
and
good
I
afterward.
did. When I finally was able to relax enough and do it,
Yep.
it got so much stuff out, and I felt so good. My head felt wide open, and I was breathing well.
Why do you think
probably need it now?
Why do you think you were able to do it that day? Just because we were encouraging you?
Yes.
Okay.
Peer pressure, and I also knew that if I started to drown, I had people surrounding me that would save my life.
Okay. Well,
after we finish
next time you feel like you need to do it,
I'll just
come on over.
over to the show and we'll do it.
Be happy to help you out with that. All right. Well, thanks everyone. Thanks to everyone at SiriusXM whose steadfast support of this show has sustained us over the years, particularly Lewis Johnson, Jim McClure, Sam Roberts, James Norton, Travis Teff, Troy Henson, Paul Ovcharsky, and Roland Campos. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Thank you.
Yay.
All right. We got any questions from the fluid?
Yeah, we got a good one.
Okay. All right. What do you... you want to just do it?
Yeah, we'll just do it.
Okay, we'll just do it on the fly.
We'll get it.
All right,
we can handle this one.
Here we go. All right, before we go, Dr. Scott, you got some questions from the Fluid family. And by the way, if you want to join the Fluid family in the waiting room, check us out at YouTube. It's youtube.com/@weirdmedicine. And we're usually on at 1 o'clock on Saturdays Eastern time, but it can vary. Today we did it early. And if you'll just subscribe and click the notification bell, then you'll be notified, or follow us on Twitter at Weird Medicine, and I usually send something out. Also, I think I'm on Facebook as Stephen Chipperson. Follow me there, and then I do that as well. But feel free to join us anytime.
Cool.
All right. And we have some new... looks like Joe Dicker joined the Fluid family.
The Fluid family, that's correct.
Yeah, and you can gift memberships, and you can do, if you go to tips.drsteve.com, you can do super tips, which you can say anything you want, and it shows up on the screen, supposedly. I haven't figured that one out yet. But yeah, we have...
I love being part of the Fluid. I love being part of the Fluid
I
family.
don't want any of your fucking...
Yeah, we'll take it. Take it.
No, you have to do it online.
I'm on tip. Was it 99 cents?
No, don't worry about it. You have to do it online, because if you give it to me, then
I know that you're going to give it to Tasty and y'all going to go have dinner.
Then they don't get the they don't get the memberships.
I guess you and I are just
give it to Mel B.
We're SOL.
We're just going to start.
Anyway, so that's the deal. So anyway, so what do you got?
Yeah, we got a question from Carl's Cottonmouth. He says every time he gets off of an elevator, he still feels off. It's weird. It's like I'm on the elevator still, even after I get off of it. So,
yeah, you want to talk about?
I was going to say, it's the little fluid inside the semicircular canals, right?
Very good.
Give thyself a bell.
Yeah, and
So
with
tell
the
'em what
motion,
those are.
with it's the three little fluid-filled tubes inside of your ear that are filled with little hairs, and when that fluid swirls around there, it tells your brain where your body is in space and time.
That's right.
And,
Those are your accelerometers.
Yeah.
So they
inside that
you have proprioception that tells you where those are. It's like derivatives or velocity and acceleration, right? So the there are two. One is rate of change, which is acceleration. And velocity is well, it is a rate of change too, but proprioceptive nerves will tell you where your joints are in space.
Fingers, hands, toes.
Yeah, so I can point at you because I have this mental map, and my joints tell my brain where they're pointing, and the brain says, okay, well, you need to move over a little bit to the right to point at Scott. Now, if you have, but they won't tell you acceleration. So the semicircular canals in the brain will tell you where your body is with regard to the rest of the universe as far as rate of change of velocity. So when you get on a bar stool and you spin, those things will the fluid will start to spin, and then it spins in the direction of the spin, and then when you stop, it continues to spin in there, and that's what makes you feel dizzy.
Feel like you're still on the
because you feel like you're still on the bar
or still
stool.
in the elevator.
So it's the same thing.
Yeah.
When you're going up, the semicircular canals work in 3 dimensions, and one of those is up and down, one is left and right, and one is in and out.
That would be a compression.
Correct. Okay. Yeah. So it can detect or acceleration in the direction toward the ground, and it can detect acceleration going the other way. That's what free fall is. When you're on a ride that goes up and then you're sort of weightless for a little bit, it's detecting that as well. So it's the same thing, and his just is very sensitive that it just continues to send those signals to his brain for a little bit.
Yeah, and I think we've got an expert in here that can talk a little bit more about that. Being on water, being in boats.
Yes. Oh yeah. Once you get your sea legs, and then you get off. Tell us about that.
And that was my question too. Do you get more acclimated after you've been on the water for longer? So, if we go out on a boat and it's wavy, we're going to get off and be seasick.
Right.
But
I get off. I'll be on a ship sometimes for 60 days.
Oh wow.
And then at least I used to. And then you get off and you still feel, or I would still feel it for about 48 hours.
Yeah. Wow.
And it would always be it'd go away after you laid down and went to sleep.
Wow.
Isn't that interesting?
When everything had a chance to settle down.
Yeah.
But we just had several guys come through 12 to 16 footers come around the tip of Florida the other day.
Yuck.
And of course everybody's sick.
Beat them to death. Yeah.
And you're out there and you had no choice.
Yeah.
You're going to ride it out.
I've never gotten seasick, but when we were on a boat.
You don't know what you're missing.
As soon as you start to feel it, best thing to do is just
let her rip.
Right.
Yeah. We were on a boat, and this woman got so seasick as soon as we hit the open seas. And do you remember that, Taze?
Yeah.
I thought she was going to die, and I'm the only doctor on the boat, so I just had to sit there with her. I was helpless. I couldn't really do anything but just, hold her hand and go, "You're going to be okay."
Let me ask you a quick question though. So is somebody like that after you've been on the boat and you want to get over this faster than 48 hours, would Valium help calm that down?
Maybe.
How does Dramamine affect your inner ear? Because, we used to tell people all the time, take Dramamine.
Yeah.
We were getting ready to go. I was taking the ex-wife on a cruise years ago. I was in Alaska. It's 24 hours to fly here from Alaska. By the time from the part of Alaska I was in, I'm telling her 4 days ahead of time, are you going to take Dramamine? No, I'll be fine. Okay. I talked to her the next night, 3 days before I fly in. Did you take any Dramamine? What are you going to do? What the F do I do for a living? Of course not.
Right.
What are you thinking? But, this goes on until I get there, and we don't even go home. She meets me at the airport, jump on the next flight to Fort Lickerdale, get on the cruise ship there. I register in with my merchant marine credentials and my passport, because we get professional courtesy like that. Get a call from the captain.
Can you please stop
about an hour once
bullshitting?
we're on there. I can't hear you.
Okay.
I don't have one headphone. That's why I didn't put them on. But the captain calls and tells us the fin stabilization system is not working, which is an amazing thing on big ships. It's like airplane wings.
Yeah.
They literally swing out from the bottom on either side. And so it slows the roll because that wing has to go down. The other one has to
like
get the water
outriggers
off
a little bit, sort of. Yeah.
And so as you roll back and forth, it slows the roll to everything. Except for ours wasn't going to be working on the port side, and you can't deploy one side.
Yeah.
So he's telling me it's going to be snotty. He's kind of, cool, Captain, I appreciate it. And the wife's going, what do you say? He said, we're going to need Bahama Mamas, or we're going to the top deck. I got a new J.A. Jansen novel.
You did that just to torture her.
That's why we're divorced.
God.
Yeah, it's
Well, that's one of the reasons. I'm sure. I'm sure there's more than one.
Oh yeah.
Yeah, that's just a symptom.
it's just it's a very much.
I poke people with a stick for the fun of it sometimes.
But yeah, it's so the reason. I'm not sure anybody knows why they work. The anticholinergic medications like meclizine, which is basically what's in Dramamine now. There are other versions, but they're all work on the same mechanism. They give you dry mouth, they make your heart beat fast, but they also are pretty good for reducing nausea from motion sickness. And we'll use it in people with vertigo and things like that. But the best one for vertigo is a prescription medication called diazepam, which is Valium, and it is awesome. If you have someone who has refractory vertigo and they're puking all the time and they're just constantly sick, or they're just spinning and they can't stop, diazepam actually works.
Well,
so that's why Scott was asking if you have someone that's got, what do you call it when your sea legs are still working on land?
You still have
just persistence of motion.
Motion
whatever.
sickness, I guess. Yeah, persistent.
Yeah, but they're not sick though. But you just feel like you're still.
Yeah.
But I wonder if diazepam would work for that.
That's
That'd be
a good
an
question.
interesting study.
Yeah. We have to come
the
up with
biggest
a new
thing I
one.
tell people whenever they first come on the boat, like first 24 hours, like, I think I'm gonna get seasick. Go throw up.
Yep.
Yeah.
Make yourself throw up. Get it out of your system. You'll be fine afterwards.
Yeah.
Because now you're just gonna be fighting it. It's gonna happen. You're just gonna torture yourself.
I'm just glad I don't ever have to worry about that. Because I love going out on the ocean.
Right.
Why are you shaking your head, Mel B? Are you a seasick type
I've been
person?
on 2 cruises,
Yeah.
and both times got very, very sick.
Really?
And stayed sick for about 2 weeks after.
Oh God! Did you use scopolamine?
I tried it the first time, and it messed with my vision.
Yeah.
I couldn't see, and that was giving me migraines, so I took the patch off.
No.
So I found the second cruise I took, I found Zofran during the day.
Yeah.
I took meclizine around the clock. Took Finnegan at night because it made me slick.
Oh my
Did you
God.
And
consider-
then I just woke up and drank tequila.
I was
So
about
I
to say,
didn't
did you
care.
consider Bahama Mamas?
Yeah, I just the bartender would come in and he goes, "What you want with your tequila today?" And
Oh my!
I would have orange juice.
Orange
and
juice, yeah, 'cause
tequila
it's
for
breakfast.
breakfast.
That's always
I'd
bad.
have like whatever. He'd make me drinks all day, and
Yeah.
then
Did it help?
I kept.
Could you enjoy it?
I did. I just didn't give a shit anymore that it felt bad.
Yeah.
So, and then I stayed sick for 2 weeks. I'd walk down the hall at work and the floor would be moving in a wave.
Oh.
It was awful.
Yeah.
And it lasted probably close to 2 weeks. So no more cruises for me.
Yeah. Don't blame me.
Now, going out on the boat, like on a lake, doesn't bother me. I've been deep sea fishing,
Yeah.
like on a smaller boat.
That didn't bother you?
It did.
Yeah, I would think so.
And the captain of the boat, thank you. The captain that we were out with, every time I'd start getting queasy, he'd have me stand straight up and look
Look at the
far,
horizon.
like look at the horizon.
Yeah.
And he's like, just focus on that. And he'd tell me to take slow, deep breaths, and then I was fine.
You know, the crazy thing with that lady that had the worst seasickness I've ever seen on that boat that we were on, as soon as we entered calm waters, she was totally fine. Yeah. Just totally fine.
No.
Good.
Yeah.
You wonder if it was more mental.
Yeah. Well, I don't know.
Yeah.
We were on the cruise, supposed to take off at like 5 o'clock. It was 4:15. And we were doing something, maybe getting unpacked in the room or whatever. And the person I was with, I said, "We're moving." He's like, no, we're not. I'm like, yeah, we are. So we walk around the boat. I'm like, we are moving. I'm ready to throw up.
Wow.
And got up to the top. Sure enough, we'd taken off a little early. And I immediately was sick. I tried the throwing up thing. I did that multiple times every day. It never helped.
Yeah.
But
Yeah, you're just sensitive to it.
yeah, I'm tender.
She's little.
I'm fragile.
Just weirdo. She's just weirdo.
All right. Well, you got anything else, Dr. Scott?
That's all, but
All right. Well, thanks
wrap it up.
everyone for hanging out with us today. We really appreciate you, and listen to our Sirius XM show on the Faction Talk channel, Sirius XM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. And it looks like Barb Parrish got banned. Why did she get banned? What did she say?
I don't know. It couldn't have been. It's hard to see. I was looking, but I couldn't see.
Well, it just says, let me see here.
She was timed out by SteamYard or something.
Can someone explain memberships on this channel to me? I have subscribed to the channel, but don't see anything about membership. Okay. Yeah, so Barb, you have to go down to where the $ is and then click join, I think. I'm not 100% sure. There should be a... So, and why did SteamYard ban her for that?
No idea.
That's a
just
perfectly,
said time.
Perfectly valid question. I'm sorry, Barb, but anyway, I'm gonna have to fix that. It's we have a rogue robot in our.
It's a sensitive bot like Mel B.
All right, very good. Well, anyway, so go to our website, drsteve.com, for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Goodbye, everyone.
See ya.
All right, let's do